welcome back to the Mr. Think Smart Show. I have a special guest today. I told y'all before, I only interview the jewels, people who are out here helping the world to be a better place and empowering and inspiring. I have a woman today. She has been in practice for 36 years, and she is empowering on a natural level, and we love it. So today, I want you to introduce yourself to the world. Ma'am, tell the people who you are.
I'm Dr. Joyce Johnson. I'm a pediatrician in private practice, St. Louis, Missouri. I've been in practice for 36 years.
36 long years. That is, that's almost my entire life.
All right.
That means you good, and you love what you do.
I do. I can't imagine ever retiring. About 10 years or so ago, I said, well, I'll retire in about 5 years. And I keep saying in 5 years, and now I can't ever imagine putting the key in the door for the last time. So
I understand, because you love it. And if you do something you love, you just never want to stop. I get it. I get it. So, Dr. John, let me ask you just a few questions before we really get into this interview. So, where were you born and raised?
I was born in Cleveland. We moved to a small town right outside of Cleveland, about 45 minutes just before the riots hit in the 60s. And moved to a small town. There were about 9,000 people in the town, 7 stoplights. There was a college there. So I stayed there probably about 20 years or so.
Okay. So speaking of college, moving forward, so I'm guessing you went to school there. Where did you go to college? Where did you go to school? Where did you get your degrees from?
My undergraduate was at Oberlin College. My medical degree was at Case Western Reserve University, and I received my internship and my residency at St. Louis Children's Hospital. Wow,
what a journey! So over the course of these years, I know you've met a lot of great people. She actually said she knew my childhood doctor, Dr. Homer Nash, and you said you learned a lot from him. But I know you learned a lot on the way. So moving forward, when it comes to your practice, could you tell the people a little bit more about what you do?
I'm a pediatrician that's been well trained at Children's Hospital, which is Washington University, in traditional medicine. And what I have done in my practice is I marry that to my upbringing. My upbringing, I'm 65 years of age. I had grandparents around me. So what I have done is I have, if you will, married the two, which would be traditional academic medicine to what I call common sense, natural methods.
Wow. So when did you, during the course of these 36 years of being in practice, when did you decide to go into your own practice?
I knew I would always go into my own practice. I can imagine I might be a little bit difficult to get along with at times. So that was one thought, but I think what really drove home the point that I would do best, no one person can live up to all your expectations. And I believe that my thoughts are commitment, my level of commitment might not be someone else's level of commitment. And I think it's just best that I run my own show.
I get it, and I understand. We're going to take a small break, okay? Johnson, so is there any mind-blowing experience being in your profession that you could share with us?
Yes, I can think of many, so many, it's almost hard to single down on one, but I want to give you two. The one that really stood out, and then say, my goodness, just look at what God has done. I had a young lady in my practice who was aged probably about 3 or 4. She was in the basement of her home. She had fallen onto a Coke bottle that was broken. The Coke bottle went into her heart. So it went straight through. And she walks up the stairs with blood coming out of the Coke bottle and says to her mom, "Mom, look at this." Now, the fact that this 3 or 4-year-old could even walk up, so I think she was 4. And Mom was an EKG technician. And she knew, she worked in a hospital, she knew to push the bottle in even more. Because by pushing the bottle in even more, she was putting pressure on the blood vessels so that would help to stem the amount of blood that was coming out of the Coke bottle. I think most people would have snatched out the bottle. She knew what to do. She called 911. They went to the hospital. They went to St. Louis Children's Hospital. And for some reason, they stopped by the emergency room. Usually during something like this, they would have gone straight up to the emergency. They would have bypassed the emergency room, and they would have gone straight to the operating room. But they went to the emergency room, then they went up to the operating room. The next day, she was so healed. The doctor said they had never seen anything like that. They released her in less than 24 hours.
Wow.
Can you imagine that she made the news? She came here to my office. She jumped up on the table for me to take out her stitches. And I was about ready to fall over. And I have those stitches to this day. To me, that was a miracle because Mom had to know, push in. I would have pulled out. The fact that she had no brain damage, the fact that the doctor said she was so healed, they didn't even see her for follow-up. And you had to go to the doctor for follow-up for an ear infection, but they said they'd never seen anything like it. She made the news.
Wow. Interesting.
That's a miracle.
It is a miracle. It is mind-blowing. Mm-hmm. So you said you had another story.
I had another one. A gentleman came to me the other day, and he is going to take over guardianship for his sister. Unfortunately, mother's died. And he asked me, did I know of anybody, where could he get this done? Because in order for him to provide for her the care that she needs when she goes to specialists, anything that needs a signature, he can't sign for her because he's not her guardian. And nowadays, legal services can be really expensive. Mm-hmm. I said, let me think about this. I'm sure we can find someone. The very next day, in the morning, I'm talking with another mom. And I said, oh, by the way, at the end of the session of the doctor's visit with her child, I said, by the way, I have a father who is in need of some legal assistance. He wants to obtain guardianship for his sister, and we need it to be affordable. Okay. He says, wow, that's what I do for a living. The government will do that for you free of charge. I go, wow. I said, lady, you have been a blessing to someone today. Thank you so much.
Yeah, that's another mind-blowing. So you have seen, heard miracles throughout your practice. That's another reason to keep going. Yeah, that definitely would keep you going. Mm-hmm. So if you had to forecast the next 5 years, I know you talked about it earlier about every 5 years you're like I might retire, but if you had to forecast the next 5 years, where do you see your practice going?
I think I have a gift for helping children who may have 1 or 2 extra pounds lose the 1 or 2 extra pounds that they need to lose, and to help them feel good about themselves and to help their families feel good about themselves. So 5 years from now, I'm asking God to show me how to be a blessing to those families. Yeah. You're empowering, you're building confidence, yes,
and you're encouraging them to move forward and be happy as they move forward.
And to lose the weight that they so desire and become healthier in the process.
That's amazing.
Yes.
I love it. I can't do nothing but love it. So if you were to thank anyone moving forward about where you are right now, sitting in that seat right now, in this interview, who would you thank for those 36 years? Actually, you can actually say more than that, because you actually studied, you knew what you wanted to do, you had a vision, you went through that, and then you practiced for 36 years. Who would be the people, places, things, no matter what it is? Who would you thank?
The first rotation I did coming out of during medical school.
Mm-hmm.
It was during medical school. Was at Cleveland Clinic. That's where I first started in pediatrics. And there was a physician there, the attending doctor, and he said, many people will try to change you to stay who you are. And I think he helped me to weather the storms. Because in medicine, as a soft-spoken woman, I was told I would never make it. I'm too soft-spoken, and I needed to be more forceful. But I could hear his voice saying, just stay who you are. There's a place for you. So I think he was very instrumental in helping me become the person I am today.
I love it. I love it. Thank you, Dr. Johnson. We're going to end it on that. We have a lot more to do, but we're going to end it on that.
Okay.
Your story is amazing. Your journey is amazing. The 36 years that you put into this practice is amazing. Even talking to you off camera, we want to thank you. We want to salute the divinity in you, because you are the type of people that we want to put out there. We want people to know. We want people to understand that the heart of the people are still being the heart for the people. The heart for the people is still a need for that. More people that's going to come, that's came before you, like that gentleman that you said, that doctor that told you that, to tell you to stay you, because he knew that you had something special, and you have something special that I know that you're going to pass down. Thank you.
Thank you. My pleasure.
Bye.